Hi, and welcome to the Basic Awareness of Adult Safeguarding presentation, provided by the Rochdale Borough Safeguarding Adults Board. It's important to recognize that this video does not replace the basic introduction to safeguarding adults training provided by your organization. The video will help you understand what abuse and neglect is, how to recognize it, and what to do when you suspect an adult is being harmed. It's important you understand that your job is not about investigating abuse or neglect. Your job is to report it and keep the adult safe. People with care and support needs, such as older people or people with disabilities or communication problems, are more likely to be abused or neglected. They may be seen as an easy target and be less able to report it. They may not realize that what is happening is abuse or neglect. Signs of abuse can be difficult to detect. This briefing will run through the types of abuse, how to recognize them, and what to do. This is a list of the different types of abuse. Take a moment to read through the list. Let's look at each of these in turn. This narration will only give a summary of each slide, so make sure you take a little time to read the slides thoroughly. Pause the video if necessary. Physical abuse is first. This includes hitting, kicking, slapping, burning, and rough handling. It also covers misuse of medication and unauthorized restraint. The signs can often be seen on the person's body in the form of cuts, bruises, burns, failure to seek medical attention, and subdued or changed behavior in the presence of a particular person. Domestic violence or abuse can be characterized by any of the indicators of abuse outlined in this briefing, relating to psychological, physical, sexual, financial, or emotional abuse. Domestic violence and abuse includes controlling, coercive or threatening behavior, violence, or abuse. It also includes so-called honor-based violence, female genital mutilation, and forced marriage. Possible indicators of domestic abuse include low self-esteem, feeling that the abuse is their fault when it is not, physical evidence of violence, verbal abuse, and humiliation in front of others, fear of outside intervention, damage to home or property, and isolation from others. Sexual abuse. This includes rape or sexual assault, inappropriate touching, or any sexual activity that the person lacks the capacity to consent to. It also includes sexual teasing or innuendo or sexual harassment or witnessing of sexual acts. Signs of sexual abuse could be bruising, particularly to the thighs, buttocks, and upper arms, and marks on the neck, torn, stained or bloody underclothing, bleeding, pain or itching in the genital area, sexually transmitted diseases, or pregnancy in a woman who is unable to consent to sexual intercourse. Psychological or emotional abuse can be things like enforced social isolation, preventing the expression of choice and opinion, failure to respect privacy, harassment, use of threats, humiliation, addressing a person in a patronizing or infantilizing way, threats of harm or abandonment, or cyberbullying. Indicators of emotional abuse include an air of silence when a particular person is present, low self-esteem, or signs of distress. Moving on, the next category is financial abuse. This covers things like theft, fraud, scamming, or preventing a person from accessing their own money, benefits, or assets. Indicators include missing personal possessions, unexplained lack of money, unexplained withdrawal of funds from accounts, or anomalies with a lasting power of attorney. The next category of abuse is modern slavery. This covers human trafficking, forced labor, domestic servitude, sexual exploitation, and debt bondage, that is, being forced to work to pay off debts that realistically they never will be able to. Possible indicators include signs of physical or emotional abuse, appearing to be malnourished, unkempt, or withdrawn, isolation from the community, seeming under the control or influence of others, living in cramped or overcrowded accommodation, and/or living and working at the same address. Discriminatory abuse includes unequal treatment based on age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion and belief, sex or sexual orientation, or any other irrelevant factor. Signs might include the person appearing withdrawn and isolated, showing expressions of anger, frustration, fear, or anxiety. Then there's organizational abuse. This is where support agencies have rigid and inflexible routines, a lack of choice and individualism, block treatment, and a lack of respect or dignity. This can be seen in inadequate staffing levels, rigid routines, and communal possessions and clothing. Next comes neglect. This is things like failure to provide or allow access to food, shelter, clothing, heating, stimulation and activity, personal or medical care, providing care in a way that the person dislikes, failure to administer medication as prescribed, refusal of access to visitors, and so on. Remember, this narration is only a summary. Please take time to read the slides thoroughly. Pause the video if necessary. Signs of neglect include a poor environment, dirty or unhygienic conditions, poor physical condition or personal hygiene, pressure sores, malnutrition, or unexplained weight loss. And the final category is self-neglect. This is where a lack of self-care develops to an extent that it threatens a person's health and safety. This can be evidenced by very poor personal hygiene, living in squalid or unsanitary conditions, hoarding and non-compliance with health or care services. That's the end of part 1 of this briefing. You can now move on to part 2. Thanks for watching.